My name is Dr. Rehan Haidry. I'm a Consultant Gastroenterologist and Interventional Endoscopist at Cleveland Clinic in London. Achalasia is a swallowing disorder where the muscle at the lower end of the esophagus, or food pipe, fails to relax after we swallow. As a result, it stops food from entering the stomach. Patients will experience food sticking in the esophagus after eating, which can be uncomfortable and often quite dangerous. The most common symptoms of achalasia are pain when swallowing, regurgitation, and even vomiting after eating or drinking. Conventional and historical treatments for achalasia have focused on treating the muscle at the lower end of the esophagus. These have varying degrees of success, however often need to be repeated. For example, balloon dilation, where a balloon is positioned to stretch and dilate the muscle at the lower end of the esophagus, will often need to be repeated up to twice, and patients will need to return in up to 20% of cases. Another option, Botox injection, may need to be repeated every 3 to 6 months. Surgery has for a long time been the gold standard for treating patients with achalasia. It has high rates of success, but is invasive and often will have medium and long-term sequelae. Here at the Cleveland Clinic, we're proud to offer per-oral endoscopic myotomy, or POEM, which is a newer and far more effective permanent treatment for achalasia. POEM is a minimally invasive endoscopic solution, and the procedure does not need to be repeated. In over 90% of cases, complete symptom resolution is achieved. POEM is carried out via an endoscopy. This is a thin, flexible tube with a camera on the end which passes through the mouth and into the esophagus. Once in place, we use a special piece of equipment to make a small cut or incision in the superficial layer of the esophagus. This then allows us to very safely tunnel between the layers of the esophagus to isolate the muscle that is involved in achalasia. We are then able to carefully cut this muscle and remove the endoscope. This is not an operation and is not surgery. It is very safe and does not involve any scars on the abdomen. The POEM procedure normally takes between 30 to 45 minutes, and the majority of patients can go home within 24 hours after the procedure.